Concerning the post I made yesterday about the infection, a lot of people came to my DM and they were asking me to explain this further on the infection. So today I decided to choose a particular infection to deal on. This infection is vaginal yeast infection. Let's talk about more on vaginal yeast infection to create an awareness on yeast infection. A lot of people are misquoting this yeast infection. A lot of people don't know how this yeast infection come about. So first of all, let's start by saying a vaginal yeast infection is a type of fungal infection. Your body is a type of fungal infection. So get the context clear. It's a fungal infection. Then your body contains a kind of yeast called candida. Your body contains a kind of yeast. Your body wey you see so now contain yeast wey dem dey call candida, make I use pidgin, which causes vaginal yeast infection. You see, this candida causes the vaginal yeast infection. Yeast is a type of fungus. Yeast as a whole is a type of fungus, which means yeast is in the family of fungus. Why candida is a specific type of yeast. Candida, get the context. Yeast and candida. Yeast is a type of fungus, while candida is a specific type of yeast. When this yeast is in balance with your body, there are no problems. But when the yeast is out of balance, that is where the problem will come. That's when you grow ill and all those stuff like that. Then a yeast infection causes one of the causes of yeast infection that you see. You'll be getting burns in your skin. Then there will be itching in your vulva. The vulva is the outer part of your vagina. Those vulva, outer part of your vagina, that's what we call vulva. There will be itching in that place, burning. When you want to pee, these are the symptoms. So the symptoms, what you will see when you want to pee, you'll be having pains. Some people also have pains during having sex. It depends on your symptoms, but these are the symptoms of the yeast infection. Mind you, yeast infection is not a sexually transmitted infection. We'll come to what causes it. It is not a sexual transmitted infection. A lot of people are getting this thing wrongly. They are getting it wrong. They don't know what is the causes of this yeast infection. So what am I trying to say? What can cause this yeast infection? Sometimes pregnancy, your hormones. Pregnancy can cause this yeast infection. Diabetes, when when somebody is having high sugar, the person will urinate very well. So those urination causes that burning sensation. It will start to cause the yeast infection. You understand? Then another thing is wet clothes. Always make sure you keep your clothes very, very, very neat and hygienic. If you know your undies are so old, what you do, you change them. You get a new one. You understand? You can't be wearing one pint for 3 months. You can't change it. You understand? So what am I trying to say? Another factor of what can cause this yeast infection is antibiotics. A lot of people abuse this antibiotics. That's why before you take any antibiotics, make sure you've gone to run a proper test, and that test detects the antibiotics you take. Because one thing people don't understand, we have the good bacteria and we have the bad bacteria. So when the good bacteria is being defeated by the bad bacteria, it will now make you to feel ill. So there are good bacteria in your system, so know the right drug to take, so you will not kill or bring down the bad bacteria. Being pregnant is also one of the causes, one of the things that can cause this yeast infection. Then your immune system, if your immune system is weak, it can also cause it. Like I said, when you have unmanaged diabetes, can also cause it. Your lifestyle, certain lifestyle risk factors also increase your risk of a vaginal yeast, such as you're sitting in a wet bathing suit, not changing out of sweaty clothes. When your clothes is over sweat, sometimes you dry them. All those things can cause yeast infection for you. Wearing scented tampons or using a vaginal deodorant. People that are using vaginal deodorant, note that those things can cause yeast infection. Like I said, the symptoms and the causes. I've told you about the causes and I've told you a bit about the symptoms. I want to still go deeply on the symptoms. I said an itching or burning sensation in your vagina and vulva, a thick white discharge with the consistency of cottage. Okay, this discharge of a vaginal yeast infection, let me tell you how it is. You see some white thick discharge that will be coming out just like cottage cheese, lumpier, very thick. It will be coming out like that from your vagina. Then you'll be having a burning feeling when you pee. Anytime you want to pee, you'll be having some burning feelings. Those feelings like as if you want to pee, those feelings will come out. You'll be having those feelings. So different symptoms like that. Some people even have pains during sex while they are having this vaginal yeast infection. So another name for this vaginal infection, there are other names for the vaginal infection. You can be called, another name for this yeast infection can be called vaginal candidiasis or vulvovaginal candidiasis. So if you get this name, just know you are having a yeast infection, vaginal candidiasis or vulvovaginal candidiasis. This is another name for yeast infection. So if you have these symptoms, what do? Go and see your doctor. If you explain about these symptoms, these signs you are seeing, these symptoms you are seeing, they can say they want to run another test for you to be sure if it is yeast infection. Or if you can't go and see your doctor, come and meet me. I will tell you what and what to do. I recommend something for you to use. If there's any need of extra tests, you can run it so we get it clear. We know what to do. So get this awareness. Get this awareness of yeast infection. If there's any question you want to ask, go to my comment section. You ask me and I'll be there to answer you. My name is Big N Medicals. Thank you for listening. Hope you've learned something about this yeast infection. Thank you.